Hi, I'm Gitersonke, CEO of Health Insurance Answers. And today we're going to discuss what do you do if you already have a medical bill in collections. Well, the first thing you need to do is call the patient advocate. And the patient advocate is going to have you sign an authorization form so they can talk on your behalf to this collection agency. Now, if you've ever dealt with a collection agency, they're not friendly and they're not nice and they don't care. And when you're talking about your medical care and a bill that got sent to collections, you're going to have no luck if you contact the source of that bill. So for instance, you went and got an x-ray done and it ended up going to collections. If you call the company that shot the x-ray for you, it's already been written off of their financial books, which means that legally they can't even talk to you about your bill anymore. They've sent it to an outside collection agency who's licensed through the state. Now you have a few options here. If you just got sent to collections for a medical bill, you can write a dispute letter. It has to be in writing and it has to go to the collection agency and the source of the bill. So in this case, it would go to the collection agency and one copy to the x-ray company. They should be sent certified mail saying that you are disputing the bill under the Fair Debt Collections Act. Now you have bought yourself at least 30 days. In this case, you need to have that bill reviewed by an advocate. And what the advocate will do is they will go through that with a fine-tooth comb. So we had a patient recently that was a Medicare patient that got sent to collections. When we pulled the bill and talked to the provider, we realized they had never had the patient sign an ABN form for Medicare. And that is an advanced beneficiary notice. What that means? It means that the patient can now be billed for that service, but they have to have the patient sign it at the time of service. So this provider's office did not do that, sent the patient to collections for the balance due. So what we did, our patient advocates called that collection agency, not only got that removed out of their collection report, sent back to the provider of service, and also got the patient a refund. The national statistic on collection accounts and bankruptcies show that almost 70% of all accounts in bankruptcy are due to medical bills, or have a primary part to play in that patient declaring bankruptcy. It's very important for patients to understand they have a recourse and a resource in order to fight these unwarranted charges that go to collections.